Research suggests that a new strain, GII17P17, is a key driver behind the surge in norovirus, having been detected in nearly 7 out of 10 outbreaks in the United States this season. This strain has displaced a previous dominant strain, potentially due to lower population immunity, explaining the unusual wave. Outbreaks are commonly reported in settings like healthcare facilities, restaurants, schools, childcare centers, and cruise ships, with long-term care facilities accounting for over half of U.S. outbreaks. Symptoms include nausea, stomach pain, body aches, headache, and fever, typically lasting 1 to 3 days, with severe cases more common in vulnerable groups like infants, the elderly, and immunocompromised individuals. Transmission occurs via the fecal-oral route, with as few as 10 viral particles needed to cause infection, making outbreaks hard to control, especially in close contact settings. Norovirus, often referred to as the stomach flu, is a highly contagious virus causing vomiting and diarrhea, and it is the leading cause of foodborne illness in the U.S., with an estimated 19 to 21 million illnesses annually. Recent data from the CDC indicates a significant increase in outbreaks, with 1,676 reported from August 1, 2024, to February 5, 2025, compared to 729 during the same period last year, as per the CDC's Norostat data. This surge is particularly notable in the winter months, with outbreaks most common from November to April, when people are in closer quarters. Specific weekly data shows a sharp rise, with 91 suspected or confirmed outbreaks reported for the week ending December 5, 2024, up from 69 the previous week, exceeding any other week in 2024 and the same week in previous years, according to CIDRAP. By early January 2025, the number reached 97 for the week ending January 9th, and at least 128 the week prior, more than double the number recorded during the same period over the last 3 years. This early peak, reaching the highest level for this time of year since 2012, marks a shift from recent years when peaks typically occurred in March or April. An unexpected detail is the timing of this surge, with outbreaks hitting earlier than usual, driven by seasonal gatherings and travel, contrasting with the disrupted patterns during the COVID-19 pandemic. The CDC's National Respiratory and Enteric Virus Surveillance System reported 22% of norovirus tests positive for the week ending December 21, 2024, higher than seen in recent years. The CDC is actively monitoring the situation through surveillance systems like Norostat, which provides real-time reporting of outbreak activity in 14 states, and CaliciNet, a network for genotyping norovirus samples. They have reported the increased numbers and trends, emphasizing the importance of prompt investigation and reporting to identify causes and spread, as per their outbreak response page. The CDC collaborates with state health departments to collect specimens, perform diagnostic testing, and provide epidemiologic consultation, ensuring a coordinated response. They also offer guidance on prevention, such as hand washing and proper food handling, to reduce transmission. The FDA has taken specific actions to address foodborne norovirus outbreaks, given the virus's association with contaminated food, particularly oysters and berries. They have issued multiple advisories and recalls, such as advising against serving or selling oysters harvested from December 2nd to December 17th, 2024, by Rucos shellfish from Washington state due to norovirus contamination, as reported by Forbes. Another recall was issued for oysters and manila clams harvested from November 15th to December 11th, 2024, by Rudy's Shellfish from Pickering Passage, Washington, as per an FDA alert. Most recently, on February 18, 2025, the FDA expanded the oyster recall to include those harvested from Louisiana Harvest Area 3 from specific dates due to potential norovirus contamination. This action is part of the FDA's ongoing efforts to ensure food safety and prevent the spread of norovirus through contaminated food sources. The recall advises restaurants, retailers, and consumers not to serve, sell, or consume oysters harvested from Louisiana Area 3 during the specified period, aiming to mitigate further outbreaks linked to foodborne transmission. The FDA is working to ensure food safety by coordinating recalls and advising consumers and retailers to dispose of potentially contaminated products, collaborating with the CDC when food links are identified, as per their strategy for preventing outbreaks linked to fresh and frozen berries. Okay, if you found this video helpful, be sure to like, subscribe, and turn on notifications so you won't miss our upcoming videos. Leave your comments below. We'd love to hear from you and continue the conversation. Thanks for watching, and we'll see you next time.